Dr. Thomas Schmittdiel is back on the podcast today. He's a board-certified physician in family medicine and sports medicine, practicing at Franciscan Health, and today he's here to talk about some of the most common injuries that he treats, including strains, sprains, and fractures, and how he's able to help patients get back to sports and living as soon as possible. This is the Franciscan Health Doc Pod. I'm Scott Webb. Doctor, it's great to have you back on the podcast. Last time we talked about the rotator cuff and how it gets injured and how you help folks. And today we're going to talk the common injuries, strains, sprains, fractures, all that good stuff. Just before we get rolling here, I want to have you tell listeners about your specialties, your background. I know you have a sort of family history in medicine. How did you get where you are today being a sports medicine specialist?
Yeah, well, thank you so much for having me. I am a primary care sports medicine physician. So, what that means is I have a background and I did my residency training in family medicine. So, a little bit of a generalist primary care physician. And then I was lucky enough to have an additional year of focused musculoskeletal and ultrasound training with the sports medicine fellowship. So, I do not do surgery, but my goal is to treat and help people with non-operative musculoskeletal needs. And so we're talking right up my bread and butter with our strains, sprains, and basic fractures.
Yeah, like I said, sort of the greatest hits. So I want to have you just kind of talk a little bit more about them, the most common things that you see, how folks end up there in
Mhm.
the office, and maybe the differences. Like, what's the difference between a strain and a sprain and a fracture and so forth?
I'm happy to talk about all that. I will say, from a medical perspective, most doctors, when they talk to each other, aren't going to refer to injuries as sprains and strains and things like that. We try to grade the injuries a little more scientifically. But I think for everybody who's out in the real world and dealing with these issues, the way I remember it is I think of a sprain as when you hurt a ligament, a strain is when you injure a muscle, and then a fracture is when you break a bone. And for those who don't know, we try to differentiate different parts of the body and how things are connected. And so ligaments connect bones to bones and are major support and structural part of your skeleton. A tendon connects a muscle to a bone, and that's the main point to where your muscles are able to move your skeleton and you can move around, do the things you want to do. And then the bones themselves are basically your scaffolding or your structure.
Yeah.
And so that's how I think most people should at least understand sprains, strains, and fractures.
Yeah, that's a perfect way to break it down. And I'm sure just, being a person who's lived over 50 years and played sports and my kids played sports, and it's just so easy to do these things, right? Like, I
Mhm.
mean, I've stepped out of the shower and I think I gave myself plantar fasciitis. So these things, strains, sprains, fractures, maybe just give us a sense. The people that you're seeing in the office, whether it's young athletes or older adults playing pickleball, like, how are they getting there? What are we doing to ourselves?
People are living life. It's pretty hard to
Yeah.
go through life without having any type of injury. The most common things I see are the two kind of categories I classified them in my head is, did this just happen like within the last few days? We call that an acute injury. And those are usually from traumas, falls, twists, or injuries when you're doing stuff. And then the other category is what I consider chronic injuries, which are basically overuse. Some of the tissues have deteriorated, and that just comes with living a full life. There's
Hmm.
nothing much we can do to avoid that.
Right. Yeah, it does seem like strains, sprains, fractures. I said that we talked about rotator cuff, and that could be more of a chronic thing for some folks. It just keeps getting worse over time. But a lot of these things do seem sort of more acute, whether it's
Mhm.
athletes or not. You said you don't do surgery; you're not a surgeon, so let's talk the non-surgical ways that you can treat these, ultra common injuries, and maybe what we can do at home to help ourselves.
Absolutely. The one I always like to start with because I think it helps people conceptualize sprains is the ankle sprain.
Okay.
I grew up playing basketball and volleyball. I have sprained both my ankles. I cannot tell you how many times.
Right, just lost
Um,
track, right?
Yep,
Yeah.
it's just the name of the game. But when it comes to ankle sprains, basically what happens is a person will typically misstep, misjump, and their foot will either come under or roll out. And when that happens, all the force of the body is pushed through the ankle, and the ankle is basically connected through all these ligaments. And if you put a lot of force through the ligament, it's going to stretch longer than it should. And if it stretches too long, it's going to end up partially tearing. And then unfortunately, there are the very severe cases where you have a what we call a complete tear.
Hmm.
Most people tend to invert their ankle, which means their foot comes under them, and then they will sprain the outside ligaments or what we call the lateral ligaments. And fun fact for everybody listening, the most common place people do sprain their ankle is over their anterior talofibular ligament. So next time you're at a cocktail party, you can always throw out the ATFL.
Yep.
But those are the most common ways people will sprain their ankle.
Yeah, and then how about, in terms of helping folks, like the non-surgical things you can do? Like my daughter is a basketball player, as you said you were, so she sprained her ankle again more times than I can count. And in high school season, she's able to see the trainer and get it taped and just
Hmm.
play through it, right? In AAU season, she just basically has to put her brace on and hope for the best. So, how are you helping folks in these non-surgical type situations, and anything we can do at home to help ourselves?
There are a lot of things we can do to help ourselves at home. The most common question I feel like I get, especially doing a lot of sideline coverage for some of the local high schools
Sure.
and working some amateur events as a visiting physician, people, when they roll and they sprain their ankle, their question always is, "Oh, do I need to leave and go get an X-ray?"
Hmm.
And the big thing I always try to tell people are the doctors use actually a very specific set of criteria. We call it the Ottawa rules. I'm not going to bore you with all the details of what they are, but basically, if you are not able to put weight on your ankle or through your foot and you can't walk on it, that's basically a great sign to go to the ER to get checked out.
Okay.
There are some more kind of details that if you want to go to medical school, I'm happy to talk to you about. But if you're having difficulty putting weight through it, and then especially if you give yourself a few hours of rest and you're still not able to put their weight, it's probably a good idea to go get checked out at your urgent care or ER.
Yeah, and right, as you say, if you use that sort of test, if you will, it could be a strain, it could be a sprain, it could be a fracture. But the bottom line is, if you can't put weight on it, if you can't walk on it, something is wrong. Go
Mhm.
to where the doctors are and the X-rays are and that type of thing, right?
Exactly. And I know the wait times can be annoying, but I come from the thought process of I'd much rather know early because the earlier we know, the better we can treat you.
Right. So let's talk about recovery times. Once folks have come in there and they've met with you and you have a plan, whether it's physical therapy or otherwise, how long generally is the recovery time for some of these things?
I always try to tell patients that, if they have a really bad sprain, it sometimes is even better just to have a clean break because sprains can be really frustrating and they can take a longer amount of time to heal than some bones.
Yeah.
So, full recovery from a moderate ankle sprain can take up to 12 weeks.
Hmm.
But it's actually been pretty interesting how, as we learn more and more about how people are healing, our thought process on how we treat ankle sprains is actually evolving. So the old adage is stay off it, keep it, iced up and not move it for a few weeks, let it heal. But more and more data, more and more studies are coming out to showing that we actually want to get people moving and rotating that ankle in different ranges of motion because the more we move that ankle, the less stiff they're going to feel, and it actually promotes healing.
Hmm.
So usually I always tell people within the first 2 or 3 days of a sprain, I do wanna do the classic rest, ice, elevate, compression, all that good stuff.
Yeah.
And then once you come and see us, if you're able to walk, usually we'll give you a pretty good ankle brace. My recommendation is I always like what I call the double ankle braces, where you have a lace up component and a strap component, just because I feel like they give people a little more stability than just your typical lace up brace or your typical air cast, which is a hard plastic case most urgent cares will give out. And then after you're able to walk on it a little bit, we really try to get all of our athletes and all of our patients doing some range of motion exercises just because it helps blood flow and it helps people recover quicker.
Right. As we get close to finishing up here, doctor, I wanted to ask you, is there anything that you recommend? Like, should we be bracing ourselves even though we don't have a sprained ankle? Will that help us to avoid sprains, that kind of thing?
There's not a lot of great data saying, wear a brace on every body part because that's going to completely prevent injury.
Okay.
If you have a history of injury, like you've had ankle sprains in the past, I think wearing a brace for protection is a great thing. The new thing that I'm really trying to promote with all of my athletes and, patients in general, after they injure something, I really want them to get into doing some physical therapy and rehab exercises because the stronger we get all the muscles around it, the more stable that joint's going to be.
Right.
And especially when it comes to ankle sprains, because we have a lot of small nerves that tell your brain where your foot is in space. And what I mean by that is you want to know where you're stepping without actually having to stare at your foot the whole time. And so the more range of motion, the more strengthening you do, it helps that brain foot connection and it helps heal those nerves. And it hopefully will help you from misstepping or re injuring yourself in the future.
Yeah.
So to me, doing good strengthening and good, what we call proprioceptive training after you injure something is really, really important.
Yeah, that's great. It's been great having you on both times. Rotator cuff before. Today we're talking strains, sprains, fractures. I'm sure we'll speak again in the future and appreciate your time, your expertise. Thanks so much.
My pleasure. Happy to be back and hopefully we'll talk soon.
And go to franciscanhealth.org and search sports medicine for more information. And if you found this podcast helpful, please share it on your social channels and be sure to check out the full podcast library for additional topics of interest. This is the Franciscan Health Doc Pod. I'm Scott Webb. Stay well, and we'll talk again next time.